Good morning, afternoon, or evening. Today is Wednesday, May 1st, 2024. Welcome to today's webinar, Navigating New Norms, Mastering 2024 Healthcare Management Mandates for Executive Leadership, guided by Greg Wahlstrom and organized by the Healthcare Executive. As we explore the pressing issues and transformative policies shaping healthcare today, our discussion will span from groundbreaking healthcare reforms to strategic considerations for hospital management. Ensuring comprehensive coverage across multiple key topics. As we begin by examining the significant healthcare reform introduced by the Biden-Harris administration, which will empower Medicare to directly negotiate drug prices with manufacturers. This policy shift is poised to dramatically reduce cost and shape the operational landscape of healthcare organizations. Our exploration will provide a contextual foundation and discuss the strategic implications for hospital management, including how these changes will affect financial planning, procurement, and patient care strategies. Next, we'll navigate through the recent updates to the Affordable Care Act, focusing on its expanded coverage and strategic responses required for healthcare institutions. The discussion will extend to the incentives for rural health care development, highlighting federal efforts to enhance service delivery in America's rural landscapes. As we progress, the conversation will switch to the regulatory changes impacting telehealth and the integration of value-based care models. These segments will address the strategic importance of adapting to evolving healthcare frameworks and leveraging these reforms for enhanced service delivery and operational efficiency. The session will also cover important updates regarding mental health services, upscoring the administration's initiatives to improve access and treatment across healthcare spectrums. Our comprehensive coverage will ensure that patients gain a thorough understanding of these important topics, providing them with insights needed to navigate the complexities of modern healthcare management effectively. And so join us as we engage in a robust discussion designed to inform, inspire, and invigorate your strategic planning and operational approaches in healthcare. So as we look at the regulatory changes, direct negotiation and lower drug prices. Today, we explore a significant healthcare reform introduced by the Biden-Harris administration on December 7, 2023, which empowers Medicare to negotiate directly with drug manufacturers to set prices. This essential change is anticipated to substantially reduce medication costs, significantly impacting how hospitals manage their operations, especially in pharmacy budgeting and resource allocations. So from a contextual foundation perspective, President Biden believes that the healthcare should be a right and not a privilege. And for too long, corporate special interests have trickled down economics have allowed big pharma to make record profits, while millions of Americans struggle to afford health care and prescription drugs to treat common and chronic conditions. And as part of the president's bionomics agenda, the Biden-Harris administration is tackling price gouging and confronting special interests to reduce costs for consumers and ensure that every American has access to high-quality, affordable health care. The White House, 2023. This directive for Medicare to negotiate drug prices is a key element of broader healthcare reforms aimed at enhancing accessibility and reducing the financial burden of healthcare on patients and the systems alike. Implications for hospital management: the ability for Medicare to negotiate drug prices directly will likely lead to significant reductions in medication cost. This demands that hospitals adapt by enhancing their financial planning and resource management strategies. Precise adjustments in procurement and thoughtful reallocation of financial savings will be necessary to optimize optimal efficiency and enhance service delivery in other critical areas. So as we look at strategic considerations, hospitals must improve their forecasting accuracy and adapt their budgeting practices to manage resources more effectively in light of changing drug prices. These adjustments will affect various aspects of hospital operations, from pharmacy to patient care, necessitating a proactive approach to strategy and planning. Adopting these regulatory changes is vital for hospitals to remain competitive and financially viable. And the direct drug price negotiation by Medicare not only promises to reduce drug costs, but also supports a broader move towards a more equitable and patient-centered healthcare system. Hospitals that proactively adjust to these changes will be better positioned to benefit the potential long-term savings and improve patient satisfaction. So as we observed, the direct negotiation of drug prices by Medicare is poised to significantly reshape healthcare economics, enhancing affordability and access. So moving forward, let's turn our attention to another essential area of healthcare reform. And the next slide will explore recent updates to the Affordable Care Act, the ACA, focusing on how these changes aim to further strengthen healthcare coverage and ensure that quality and affordable healthcare continues to be accessible to more Americans. So we'll review the specific amendments and their anticipated impacts on both healthcare providers and recipients. Updates to the Affordable Care Act, the ACA. Today we're here to discuss the strategic implications of the recent updates to the Affordable Care Act for our hospital operations. These updates are momentous in shaping the way that we deliver care, manage financial operations, and ensure compliance with federal mandates. So as we talk about expansion and coverage, essential health benefits, EHB, as part of the Affordable Care Act mandate to enhance the scope of healthcare coverage, all issuers of qualified health plans are now required to cover an essential benefits package. This includes comprehensive services such as emergency services, hospitalization, and mental health care. According to the Department of Health and Human Services 2023, the ACA directs all issuers of qualified health plans to cover the essential health benefits package, including coverage of the services described in Section 1302B of the ACA, adherence to the cost-sharing limits described in Section 1302C of the ACA, and meeting the actuarial values levels established in Section 1302D of the ACA. This expansive coverage ensures that every plan offers a baseline of essential services, which significantly impact our hospital operations by potentially increasing patient volume and diversifying the services that we offer. As we talk about cost reduction measures, the ACA's focus on reducing healthcare costs is also reflected in the establishment of cost-sharing limits and requirements for actuarial value. For us, this translates into a need for meticulous financial planning and adjustments in billing practices to align with these new strategies. The enhanced coverage not only broadens access, but it also mandates affordability and thus impacting our revenue cycle management and patient billing patterns and systems. And as we talk about enhanced patient protections, moreover, the ACA's update strengthen patient protections, which include preventing the denial of coverage based on pre-existing conditions and existing coverage requirements. These protections not only ensure a higher standard of care, but also necessitate that we as administrators enforce these standards through rigorous compliance and operational protocols. In conclusion, the ACA's updates present both challenges and opportunities for our hospitals, but we are tasked with the dual responsibility of expanding services while ensuring cost efficiency and compliance. So as we move forward, our strategic initiative will focus on adapting these changes, optimizing operations, and continuing to provide high quality care to our communities. Looking at incentives for rural healthcare development, today we'll explore the significant initiatives undertaken by the Biden-Harris administration to enhance healthcare delivery and rural healthcare. These efforts are paradigm. Considering the unique challenges faced by rural communities in accessing comprehensive health care services. Looking at support for rural hospitals, one of the critical steps taken involves bolstering the stability and operations of rural hospitals. The administration has introduced measures to ensure that these essential institutions remain operational and continue to provide necessary services to their communities. This includes public consultations on Medicare policies that significantly impact rural providers. Furthermore, the administration supports the conversation and conversion of eligible rural hospitals to rural emergency hospitals, REHs, ensuring that they continue to offer emergency and outpatient care without the financial burden of maintaining fully inpatient services. The administration has made billions of dollars available to rural communities, including funding to small rural hospitals and Medicare certified rural health clinics in response to the COVID-19 pandemic and to improve access to care. The Biden-Harris administration 2024. These actions are essential in keeping rural services accessible and sustainable. Enhancing the rural health workforce, addressing the shortage of healthcare professionals in rural areas is another vital aspect of the administration's strategy. Initiatives such as increasing resident training opportunities, specifically in rural hospitals, and expanding the scope of practice for community health workers are aimed at developing a robust health workforce. Over $11 million has been allocated through the Rural Residency Planning and Development Program to establish training programs in family medicine, psychiatry, and other critical areas. These efforts ensure that rural communities have access to qualified health professionals, thereby improving the overall quality of healthcare services available. As we talk about expanding access to care through telehealth and infrastructure support is essential. And the expansion of telehealth services and the improvement of necessary infrastructure are fundamental to overcoming geographical barriers in rural healthcare delivery, and the extension of Medicare telehealth flexibilities and significant investments in high-speed internet connectivity facilitate access to medical consultations and continuous healthcare management from a distance. Additionally, infrastructure enhancements, supported by programs like the Rural Health Community Development Program and the Tribal Broadband Connectivity Program, ensure that essential health-related facilities are modernized and capable of meeting the needs of the rural populations. So in conclusion, the Biden-Harris administration's comprehensive approach to rural healthcare development not only addresses immediate healthcare issues and access, but also lays a foundation for long-term sustainability and resilience of healthcare systems in the rural America. By supporting hospitals, enhancing workforce capabilities, and leveraging technologies, these initiatives promise to transform the landscape of rural healthcare. And as we've discussed, the expansion of telehealth services, which has been a paramount element in enhancing access to healthcare in rural communities, significantly supported by recent policy changes and technological advancements. So now let's shift our focus to understand another critical facet that influences the delivery of these services. In the next section, we'll dive into the regulations impacting telehealth. We'll explore the legislative landscape that shapes how telehealth services are provided, which is essential for ensuring that these innovations not only reach those in need, but also in a way that is compliant, effective, and sustainable. So let's examine the regulatory frameworks that support and sometimes challenge the integration of telehealth in our healthcare system. So let's look at regulations impacting telehealth, expanding telehealth services through Medicare adjustments. In the wake of the COVID-19 public health emergency, the United States Department of Health and Human Services has made significant strides in telehealth, permanently adjusting Medicare regulations to better serve patients. Notably, federally qualified health centers, FQHCs, and rural health clinics, RHCs, can now serve as distant site providers for behavioral mental telehealth services. Furthermore, Medicare patients have the flexibility to receive telehealth services for behavioral and mental health directly in their homes, without the limitations of geographical restrictions. So these services can also be delivered using audio-only communication platforms, ensuring accessibility for all patients regardless of their technological capabilities. Telehealth Policy 2023. Strategic implications for hospital C-suites executives. For healthcare executives, these regulatory enhancements are not just about compliance, but they also represent strategic opportunities to extend service offerings efficiently. By incorporating these telehealth services, hospitals can ensure continuous care delivery, reaching a broader patient base while managing resource allocation efficiently. This approach aligns with the goals of improving patient engagement and satisfaction, KPI metrics and performance evaluations, and reimbursement models. As we further our exploration of healthcare reform, it's essential to understand the evolving shift towards value-based care models. These models prioritize patient outcomes and healthcare efficiency, redefining how healthcare quality is measured and reimbursed. Next, we'll explore how value-based care is reshaping incentives within the healthcare system and encouraging providers to focus on delivering the best possible outcomes for patients. This shift is essential for C-suite executives as it aligns healthcare providers with the broader goals of enhanced patient care and cost efficiency. So now let's talk about the impact of value-based care models. In the evolving landscape of healthcare, the integration of value-based care models has become a cornerstone for strategic healthcare management, influencing significant changes in operational and regulatory practices. As we further inspect the implications of these models, several key topics emerge as key turning points to the success of value-based care initiatives. Firstly, the importance of enhanced collaboration requirements is underscored by necessity for synchronized efforts among providers, payers, regulators. This collaborative framework is important for aligning goals and across different sectors of healthcare systems, facilitating a more seamless transition to models that prioritize patient outcomes over service volume. Such partnerships are essential in navigating the complexities and the operational challenges associated with VBC models. Secondly, government-led initiatives for VBC adoption highlight the proactive steps taken by government bodies to encourage the shift towards value-based arrangements. Initiatives like the Healthcare Payment Learning and Action Network, HCPLAN, aim to increase the adoption of two-sided risk models. Setting ambitious targets for commercial payments, these government-led efforts are instrumental in molding the healthcare landscape to support value-driven care. Lastly, the regulatory influence on payment structures reflects a strategic push by regulators to phase out traditional fee-for-service models in favor of structures that incentivize quality and efficiency. This regulatory influence is a critical driver in reshaping payment methodologies and support healthcare systems that deliver high quality and cost-effective care. Amidst these discussions, Michael Wolford, principal at Forvis, emphasizes the ongoing transformation within the healthcare sector. During a time when some industry experts say value-based care is failing, these survey results clearly indicate the opposite. More specifically, the results reflect the ongoing shift to value-based care models while also acknowledging the clinical and operational challenges associated with doing so. According to Healthcare Financial Management Association 2024. This statement not only highlights the positive trajectory of VBC adoption, but also acknowledges the multifaceted challenges that come with such transformative changes. These topics form the foundation for a comprehensive approach to implementing and succeeding in value-based care models, emphasizing the need for well-coordinated efforts across all levels of the healthcare industry. As we move forward, our discussion on the impact and implementation of value-based care models, let's turn to an important expanding field within healthcare: mental health care services. In the upcoming slide, we're going to explore significant enhancements and investments in mental health care, highlighting how these changes are designed to meet the increasing needs of communities across the nation. This segment will focus on the strategies healthcare systems are adopting to expand mental health services, ensuring that comprehensive care is accessible for all patients. We'll also talk about mental health services expansion. So today, President Biden announced a new landmark rule aimed at strengthening mental and physical health parity requirements, set to enhance mental health care access for over 150 million Americans. And this initiative really underscores a continued bipartisan commitment to robust mental health care. Building on the foundations laid by the 2008 Mental Health Parity and Addiction Equity Act, the MHPAEA, further reinforced in 2020. Despite legislative advancements, many Americans still face significant barriers in assessing needed mental health care. And a troubling reality is that in 2020, less than half of adults experiencing mental illness received any treatment. And the situation was even more dire for those with substance use disorders. This difficulty is often compounded by challenges within insurance networks, where individuals face long wait times, long waiting lists, or find that many providers are not accepting new patients. The disparity between mental and physical health access has grown. And with a recent study indicating that individuals are more than twice as likely to incur higher out-of-pocket network costs for mental health care compared to physical health, this gap has increased by 85% in recent years, pushing many to pay out of pocket for essential services, as evidenced by families in Michigan and Rhode Island who face hefty bills and bureaucratic hurdles to secure necessary care for their loved ones. In response, President Biden emphasizes that mental health is health, and his unity agenda includes a comprehensive strategy, national strategy, to revolutionize the understanding, access, treatment, and integration of mental health care both within and outside healthcare settings. So today's proposed actions are designed to, number one, ensure health plans provide adequate mental health access. New regulations will require health plans to conduct detailed comparative analysis to ensure that access to mental and substance use disorders benefits is as unrestricted as medical benefits. This will involve assessments of provider networks, payment rates to out-of-pocket and out-of-network providers, and the application of prior authorization. Number two, clarify health plan responsibilities. The rule will outline specific prohibitions against restrictive practices such as stringent prior authorization and narrow networks that impede access to mental health benefits compared to physical health benefits. Number three, eliminate regulatory loopholes. The new rule aims to extend MHPA-EA compliance to over 200 additional health plans affecting 90,000 consumers, broadening the scope of those protected under the Act. These regulatory enhancements are expected to boost the utilization of mental health services and ensure fair compensation for mental health professionals and potentially encourage more individuals to enter the mental health field. Furthermore, the administration plans to solicit feedback on how best to collaborate with states to enforce MHPA-EA's protections, especially for Medicaid beneficiaries in private health plans. Additional steps by the administration to address the mental health crisis include expanding Medicare mental health services. Proposed regulations aim to increase access to intensive outpatient, crisis care, and substance use treatment services, along with better compensation for mental health providers. Also, strengthening crisis response. Nearly $1 billion has been invested into the 988 Suicide and Crisis Lifeline, with recent expansions including services in Spanish and for the LGBTQI+ and veteran communities. It also is supporting mental health in schools, efforts to streamline Medicaid billing processes for school-based health services, aims to ease access and really expand coverage. As stated by President Biden, today's proposed rule reinforces MHPA-EA's fundamental goal of ensuring that families have access to mental health and substance use benefits as they do physically health benefits. And This is according to the White House 2023. This statement not only highlights the positive trajectory of value-based care adoption, but also acknowledges the multifaceted challenges that come with such transformative changes. These initiatives represent critical steps towards dismantling the barriers to mental health care and also affirming the administration's commitment to treating mental health with the urgency and seriousness it deserves. So, at the conclusion of our discussion on expanding access to mental health services, it's imperative to shift our focus towards critical aspects of healthcare: technological innovation and compliance. As healthcare systems increasingly integrate digital solutions and data-driven approaches, the regulatory landscape surrounding the protection of patient information becomes more key. As healthcare leaders navigate the pressing challenges posed by mental health services and its impact on health systems, it is equally imperative to focus on the technological frontiers. Transitioning from mental health strategies, we now turn our attention to technological innovations and their regulatory landscapes. The seamless integration of emerging technologies within healthcare compliance framework not only enhances operational efficiency, but it also ensures adherence to stringent standards, safeguarding both patient data and the integrity of healthcare services. So let's explore how technological advancements are being implemented and regulated in modern healthcare settings. Technological innovations and compliance. Advancing health IT. Strategic implications for healthcare leadership from the 2024-2030 Federal Health IT Plan. So the Office of the National Coordinator for Healthcare Information Technology, the ONC, under the U.S. Department of Health and Human Services, the HHS, has released the draft 2024 through the 2030 Federal Health IT Strategic Plan for public review. This vital document sets the stage for significant enhancements in health data accessibility, healthcare delivery, and equity, demanding focus, attention, and strategic action from healthcare executives. So as we look at the key highlights of the draft plan, what stands out is the strategic objectives. The plan outlines comprehensive goals centered around enhancing health data access, improving the healthcare experience, and modernizing the nation's public health infrastructure. It also supports for recent regulatory updates and alignments with the latest health data technology and interoperability initiatives, emphasize the progression towards transparent and equitable healthcare through improved data exchange and usage. Also looking at cybersecurity prioritization in sync with HHS's cybersecurity concept paper and cybersecurity performance goals, CPGs, the plan advocates for the adoption of robust cybersecurity measures within healthcare settings. So as we look at the impact on healthcare administration, enhanced data utilization, with over 88% of hospitals now integrating electronic received patient health information into their EHR systems. The strategic plan really encourages further adoption of standards like the U.S. Core Data for Interoperability, the USCDI, and the HL7 and the FHIR, making health information more actionable and beneficial. Also, public health and AI integration. The plan recognizes the growing importance of health IT and public health, and really explores how technologies such as artificial intelligence are reshaping healthcare practices and policies. So what is the executive call to action? Leverage the plan for strategic alignment. Utilize the draft plan to refine your organization's health IT strategies, ensuring that they're in line with federal goals and objectives. This alignment is significant for enhancing operational efficiency and patient care delivery. It also helps to engage in public comment, the public comment process. C-suite leaders are encouraged to participate in the public view process by submitting comments on the draft plan. This is critical and really a crucial opportunity to influence future health IT policies that directly affect your operations and strategic interest. Looking at insights for health IT leaders, Mickey Tripathi, PhD, National Coordinator for Health Information Technology, states, as part of our statutory duty to align and coordinate health IT efforts with our federal partners, ONC collaborated on the draft plan with more than 25 federal agencies. And these agencies regulate, purchase, develop, and use health IT to deliver care and improve health outcomes. And these increasingly rely on the access, exchange, and use of EHI to effectively execute their missions, said Tripathi. We look forward to public comments to help inform the federal government's health IT strategy for the coming years. So as we look forward, seamless healthcare coordination, as exemplified by the Veterans Health Administration's initiative to modernize its EHR system, the plan supports creating a more connected health ecosystem that benefits both providers and patients. As we look at accountability and transparency, the draft plan serves as a roadmap for coordinated federal efforts in health IT, promoting a transparent and collaborative approach to implementation. And so, in conclusion, the 2024 through 2030 Federal Health IT Strategic Plan is not just a policy document, but a clarion call for senior healthcare leaders to guide their organizations through a landscape brimming with technological advancements and regulatory changes. By actively engaging with these strategic plans, healthcare executives can ensure that their institutions are well positioned to capitalize on innovations that enhance care quality and operational effectiveness. As we look at public comment periods, the public comment period remains open until May 28th, 2024 at 11:59 p.m. Eastern Standard Time. So visit healthit.gov for more details on how to submit your insights and feedback. As we look at incorporating direct quotes from key figures such as Mike Tripathi, helps add authenticity to the narrative and reinforcing the significance of the strategic plan for C-suite executives in healthcare. As we conclude our discussion on the strategic implications of the federal health IT plan, it's imperative to shift our focus to another pressing challenge that profoundly impacts healthcare systems, and that's the opioid crisis. The next segment of our webinar will dig into the latest developments in the opioid crisis response and funding. We will explore how federal initiatives are aiming to enhance funding mechanisms and strategic responses to address this ongoing health emergency effectively. This discussion will provide valuable insights in how healthcare leaders can leverage these initiatives to combat the opioid epidemic and support community health. Opioid crisis response and funding. Executive briefing potential impact of proposed budget cuts on opioid crisis management. The Republican Study Committee, representing a significant portion of the House Republicans caucus, recently unveiled a budget proposal that suggests substantial reductions in funding, critical to the ongoing fight against the opioid epidemic, a public health crisis affecting a broad demographic across the United States. So as we look at the overview of the proposed cuts, substantial reductions. The proposal includes an approximate 30% cut in funding allocations that directly support families and communities battling the opioid crisis. This includes potential severe reductions to the state opioid response grants, a primary federal mechanism aiding states and territories in combating opioid misuse and its devastating effects. So as we look at the national impact, if enacted, these budgetary constraints could significantly diminish the reach and efficacy of services currently supporting nearly 39,000 Americans, potentially undermining efforts to manage and recover the opioid crisis effectively. As we look at the strategic implications for healthcare leaders, we look at resource allocation. Healthcare executives will need to reassess and strategize resource allocation to ensure continued support for opioid use disorder treatments amidst reduced federal funding. And as we look at policy advocacy, there is a critical need for healthcare leaders to engage with policymakers to advocate for sustained, if not increased, funding for opioid crisis management programs to protect vulnerable populations. As we look at operational planning, organizations must prepare for potential increases in demand for treatment services that may result in reduced accessibility to funded programs. More Americans between the ages of 18 and 49 die from opioid overdoses than any other cause, highlighting the grave implications of proposed budget cuts. At a time when more than 27 million Americans have had drug use disorder in 2022, and when we are losing one American due to drug overdose every 5 minutes, House Republicans are proposing to rip away life-saving treatment for opioid use disorder. underlying the critical need for sustained support in battling this epidemic, according to the White House 2024. President Biden has emphasized the necessity of bipartisan cooperation to strengthen the national response to the opioid crisis, highlighting his administration's commitment through various initiatives. By expanding treatment access, notably, his administration has increased the number of healthcare providers authorized to prescribe essential treatments for opioid use disorder. Also, enhancing border security measures. Efforts to improve border security aim to curb fentanyl trafficking, a significant contributor to this crisis. As healthcare executives, understanding the broader implications of these proposed budgetary changes is necessary for strategic planning and advocacy. The potential reduction in funding for opioid crisis initiatives calls for a proactive approach in organizing and financial planning to continue providing necessary services without disruption. While the opioid crisis remains a central area requiring vigilant attention and resource allocation, we must shift our focus towards another pressing challenge that signifies significant influence in the effectiveness of our healthcare delivery system, and that's funding for healthcare infrastructure. The landscape of healthcare infrastructure funding is evolving, and as leaders, it's imperative to understand how these changes can impact facilities, technology adoption, and ultimately patient care. The next segment of our briefing will explore the current trends, challenges, and strategic opportunities in healthcare infrastructure, funding equipment, and equipping us to better navigate the complex terrain and ensure our institutions can meet future healthcare demands effectively. Healthcare leaders are encouraged to review these developments attentively and participate in advocacy efforts, and also prepare their organizations for the implications of funding challenges to ensure that the progress made in combating the opioid crisis is not only maintained, but also advanced. So now, as we transition from the opioid crisis, let's look at some requiring vigilant attention and resource allocation. So we'll shift over our focus towards pressing challenges that significantly influence the effectiveness of our care delivery system. So the landscape of healthcare infrastructure funding is evolving, and as leaders, it's imperative to understand how these changes can impact our facilities, technology adoption, and ultimately patient care. And so we're going to talk about briefing that will explore the current trends, challenges, and strategic opportunities that impact healthcare infrastructure funding, equipping us to better navigate this complex terrain and ensure that our institutions can meet future healthcare deliveries demands effectively. Healthcare leaders are encouraged to review these developments attentively, participate in advocacy efforts, and prepare their organizations for the implications of funding challenges that ensure that the progress made is also maintained but advanced. So as we look at navigating new frontiers, the fiscal year of 2024's federal budget implications for healthcare leadership, the U.S. Department of Health and Human Services, HHS, has outlined a proposed budget of $144 $12.3 billion in discretionary funding and $1.7 trillion in mandatory spending for fiscal year 2024. This budget is designed to address both immediate public health challenges and also secure a healthier future for all Americans. As healthcare executives, understanding the nuances of this budget is compelling for aligning your organization's strategy with emerging federal priorities and funding opportunities. So as we look at key budget highlights and strategic implications, number one, transforming behavioral health care. Increasing access to crisis services. The budget proposed significantly investments such as $836 million in the 988 Crisis Lifeline. Enhancing support mental health crises, and the initiative requires healthcare leaders to integrate and align services with these expanded national resources to ensure seamless patient referrals and care continuity. Also, growing the behavioral health workforce. So with $387 million allocated for workforce development, hospitals should focus on training programs to expand their service capacity, particularly in behavioral health, to meet the anticipated increase in demand. Number two, preparing for future public health threats. Enhanced preparedness funding. The budget includes $20 billion over 5 years for pandemic preparedness across several agencies. For healthcare systems, this means prioritizing investments in infrastructure capability of responding to public health emergencies and efficiency. As we look at investment in medical countermeasures and supply chain, with $1 billion proposed for BARDA and significant investments in the strategic national stockpile, healthcare executives should strategize and leverage federal resources to bolster their own chain resilience and emergency response capabilities. Number three, supporting unaccompanied children and refugees. Humanitarian response budgeting. The budget allocates $5.5 billion for unaccompanied children and $1.7 billion for refugees. As healthcare systems in regions with high numbers of new arrivals will need to prepare for increased service demand and ensure that systems are in place to provide culturally competent care. Number four, protecting the health of all Americans. Maternal and reproductive health. With a focus on reducing maternal mortality and enhancing access to reproductive health services, healthcare organizations should align their women's health services with these priorities, potentially expanding programs and outreach efforts. Looking at hepatitis C and HIV/AIDS initiatives, the proposal to eliminate hepatitis C and the continuation of efforts to end the HIV epidemic signal a need for healthcare providers to increase screening, prevention, and treatment services in these areas. The fiscal year 2024 budget is crafted to confront the urgent challenges our country is facing today, and such as the growing behavioral health crisis, the need to prepare for future public health threats, and the significant arrival of unaccompanied children and refugees, as stated by the Department of Health and Human Services. For C-suite executives, the challenge will be to strategically harness these federal initiatives, transforming them into actionable organizational strategies that not only align with federal objectives, but also advance the health and well-being of the communities that they serve. As healthcare leaders, now is the time to engage with federal agencies and understand the specifics of new funding opportunities and prepare your organization for the changes ahead. Proactive engagement with these areas will be key to securing the necessary resources to implement these vital health initiatives effectively. And so while the fiscal year 2024 federal budget sets a broad framework for enhancing healthcare delivery and addressing public health challenges, another indispensable area requiring our strategic focus involves the regulation that governs our healthcare workforce. So as we move forward, it's essential to shift our discussion to healthcare workforce regulations. This next topic will explore the evolving regulatory landscape that directly affects our ability to recruit, train, and retain a skilled and diverse healthcare workforce. So understanding these regulations will be imperative for healthcare executives to navigate complexities and leverage regulatory changes for organizational growth and enhance patient care. So this discussion will equip us with the insights needed to adapt our workforce strategies in alignment with both current and upcoming federal mandates. Looking at healthcare workforce regulations. Strategic impact of House Rule 6205 on healthcare leadership. The introduction of House Bill 6205, titled the Healthcare Workforce Resilience Act, marks a significant legislative initiative that's aimed at addressing the acute shortage of healthcare professionals in the United States, proposed by Representative Schneider and his bipartisan group of lawmakers. This bill seeks to recapture and utilize unused immigrant visas to bolster the number of nurses and physicians available in the healthcare system. So as we look at the bill overview and strategic considerations for HR 6205, introduces measures that are particularly relevant to C-suite executives who are navigating the complexities of healthcare staffing. So looking at visa recapture and allocation, the bill aims to recapture 40,000 unused employment-based immigrant visas to address staffing shortages in healthcare. Of these 25,000 visas are designated for professional nurses and 15,000 for physicians. So as we look at a quote from the bill, to enhance our nation's nurses and physicians workforce by capturing unused immigrant visas underlines the legislative intent to directly address healthcare staffing shortages through targeted immigration measures. Looking at exemptions from country caps and processing priorities, removing the country numerical limitation facilitates a broader recruitment strategy, enabling healthcare organizations to source talent globally without regulatory bottlenecks. The prioritization and visa issuance based on earlier petitions dates ensure that a fair and systematic approach to visa allocation, aiding in strategic workforce planning. So as we look at operational and strategic impacts, we'll look at enhanced recruitment flexibility. The availability of additional visas, specifically in healthcare professionals, provides C-suite executives with expanded options to fill critical roles, particularly in specialized areas that face severe understaffing. Also, workforce diversification. By tapping into a global pool of qualified professionals, healthcare leaders can enhance the diversity of their teams, which can lead to improved patient outcomes and innovations in care practices. Also, looking at regulatory compliance and strategic HR planning. The requirement for labor adaptations aligns with ethical hiring practices and ensures that the integration of international professionals does not negatively impact the domestic workforce. This also necessitates meticulous HR planning and compliance checks, reinforcing the organization's commitment to fair employment practices. So for C-suite executives in healthcare, House Rule 6205 presents both opportunities and challenges. And while the bill offers a pathway to address critical staffing shortages through a strategic influx of qualified professionals, it also requires careful integration into existing workforce strategies and compliance structures. Executives must consider the operational impacts of integrating a significant number of international professionals into their organizations, including potential cultural integration challenges and the logistical aspects of relocation and onboarding. So as we look at the action steps, we should look at policy monitoring and advocacy. So stay informed about the progress of House Rule 6205 and encourage yourself to engage in advocacy efforts to support policies beneficial to support the healthcare sector. Also, strategic workforce planning. Begin preparing for the potential influx of professionals by assessing current staffing needs and gaps, and also developing integration strategies that include training programs for cultural competency and clinical integration. Also look at compliance and ethics oversight. Ensure that HR policies are updated to reflect new regulations, and that ethical hiring practices are strictly followed to maintain compliance and protect the organization's reputation. Having explored the potential enhancements to our healthcare workforce through House Rule 6205, it's important to shift our focus to another key area that significantly influences the healthcare delivery system. And that's the regulation governing accountable care organizations, ACOs. ACOs are integral in our healthcare system. aiming to foster care coordination and improve health outcomes while reducing costs. So as we move into this discussion, we'll examine the latest regulatory updates, challenges, and strategic opportunities that ACO regulations present for healthcare executives. This next segment will explore how changes in ACO regulations can impact operational strategies, care delivery models, and reimbursement patterns within our healthcare organizations and communities. So understanding these aspects is momentous for leaders to effectively navigate the evolving landscape of healthcare management and ensure alignment with federal health reform initiatives. So as we look at accountable care organizations, ACOs, regulations, strategic insights, upcoming changes to the ACO REACH model for 2024, the Center for Medicare and Medicaid Services, CMS, has announced significant updates to the accountable care organization. Realizing equity, access, and community health, ACO REACH model sets to take effect in the performance year of 2024. These changes aim to refine the model by enhancing predictability and for participants ensuring consistency across CMS programs and advancing health equity. So looking at model enhancements, in response to the comprehensive feedback from stakeholders, CMS is implementing a series of targeted adjustments to the ACO REACH model, and these modifications are designed to streamline operations and support effective management within healthcare organizations, focusing on, number one, increasing predictability. CMS aims to provide more predictability, financial and operational environments for ACOs, enabling better strategic planning and resource allocation. Also, number two, risk score consistency. To maintain fairness across the board, there will be safeguards against inappropriate risk score growth, ensuring equitable adjustments and alignments with our CMS initiatives. And number three, advancing health equity. So each participating ACO must develop a robust health equity plan aimed at identifying and implementing measurable improvements within our underserved communities. The ACO REACH model promotes health equity and focuses on bringing the benefits of accountable care to Medicare beneficiaries in underserved communities. According to the Center for Medicare and Medicaid Services 2024. So as we look at operational impacts, these strategic updates necessitate that healthcare leaders and ACOs recalibrate their approaches to include enhanced care coordination, leveraging the revised model to improve the integration services across primary care and specialty care, enhancing patient outcomes. Also looking at robust data analytics, utilizing advanced analytics to monitor and manage health disparities and response efficacy within patient populations served. Also looking at compliance and reporting, Adhering to new CMS guidelines requires updated systems for compliance, monitoring, and performance reporting. And so, as we look at governance and leadership, the ACO REACH model continues to emphasize the critical role of provider leadership and governance, especially when it comes with requirements that include provider-controlled governance. At least 75% of the governing body must be composed of participating providers, ensuring that those directly involved in patient care drive ACO strategies. Also, beneficiary advocacy. Integration of beneficiary advocates on the governing boards to ensure patient needs and perspectives directly influence ACO policies and practices. So as we look at future projections, looking ahead to 2024 and beyond, ACO REACH will serve as a catalyst for transformative healthcare practices, particularly in underserved areas. The strategic focus on health equity and provider empowerment aligns with the broader healthcare reform goals, positioning ACOs at the forefront of innovative care delivery models. The updates to the ACO REACH model represent a significant evolution in how accountable care is administered, with direct implications for operational strategy, patient care, and regulatory compliance in healthcare organizations. As these changes unfold, it will be imperative for C-suite executives to closely monitor developments and adjust their strategies accordingly to leverage the potential benefits fully. So for further reference, detailed information on the specific changes for the performance year 2024 can be found on the ACO REACH Model Performance Year 2024 Model Update Quick Reference provided by CMS. And so as we conclude our exploration of the strategic enhancements to the ACO REACH model and its implications for health equity and provider governance, it's essential to turn our attention to another critical aspect of healthcare management, and that's the expansion of maternal health initiatives. Maternal health continues to be a really pressing concern with significant implications for community health wellness and healthcare delivery. And so the upcoming segment will explore how expanding maternal health initiatives are reshaping care models, improving outcomes for mothers and infants, and what this means for healthcare systems. So we'll discuss the latest developments in maternal health policies, the integration of these services into existing healthcare frameworks, and the strategic action that healthcare executives need to undertake to align with new federal health directives and funding opportunities. This discussion is vital for leaders aiming to enhance their organization's impact on maternal and infant health outcomes. Expansion of maternal health initiatives, new presidential initiatives to enhance women's health, research and innovation. In a significant move towards transforming women's health research, President Biden has announced the launch of the White House Initiative on Women's Health Research, and this initiative aims to fundamentally change the approach to funding and conducting women's health research across the United States. So as we look at key actions and investments, President Biden has signed an executive order to advance women's health research through increased funding and integrated efforts across federal agencies. And this includes substantial funding increase. The president has proposed a bold investment of $12 billion to establish a fund for women's health research and the National Institute of Health, the NIH. This fund will support a network of research centers of excellence dedicated to women's health, setting a new standard for research and across the lifespan. And so another area, integrated research across agencies. So more than 20 federal agencies, including the U.S. Department of Health and Human Services, HHS, the Department of Defense, the DoD, and the Department of Veteran Affairs, the VA, are mobilizing to support this initiative. And this coordinated effort includes significant investments, such as $200 million from the NIH for fiscal year 2025 to kickstart interdisciplinary women's health research projects. And so this executive order directives integrates women's health and federal research. The order mandates a comprehensive integration of women's health across federal research agendas and ensures that every research dollar is leveraged to improve outcomes for women. So as we look at prioritize and galvanize research efforts, a focus on midlife women's health and menopause-related conditions will guide future investments and research agendas. President Biden is signing a new executive order that will direct the most comprehensive set of executive actions ever taken to expand and improve research on women's health, illustrating the administration's commitment to enhancing women's health through innovative research strategies, according to the White House 2024. Looking at the implications for healthcare leaders, for executives in healthcare, these initiatives represent strategic opportunity to align and benefit from federal efforts. So that would be enhanced partnership opportunities, engaging with federal research programs to advance women's health initiatives within your organization. And so innovation in care delivery and utilizing insights from federally backed research to innovate areas like menopause management and chronic disease prevention in women. And policy impacts are essential as well, and staying abreast of policy changes that could affect healthcare delivery and insurance coverage related to women's health. The new actions and commitments under the White House initiative on women's health research are set to create substantial opportunities for enhancing healthcare services and outcomes for women across the country. Healthcare executives should prepare to integrate new research findings and models into their operational and strategic plans to help them improve care delivery and outcomes for women. As we look at further resources, for more detailed information on the initiatives and specific action plans, healthcare leaders are encouraged to consult the full documentation provided by the White House and participating federal agencies. Having explored the significant stride made in advancing women's health and research and innovation through new presidential initiatives, it is now equally important to turn our focus to another important aspect of healthcare, and that's changes in emergency medical services, EMS, regulations. The EMS system plays a fundamental role in providing timely medical responses and in care emergency situations, directly impacting patients' outcomes across communities. And as we move into this discussion, we'll examine the latest regulatory updates affecting EMS and understanding how these changes are intended to improve response efficiency, enhance patient care, and integrate technological advancements in emergency medical practices. This analysis will be important for healthcare executives and leaders to adapt their operational strategies and comply with new standards, and optimize emergency medical services in line with national health objectives. So as we look at changes in emergency medical services, EMS regulations, strategic implications of the Para-EMT Act of 2023 for hospitals and healthcare systems executives, the recent introduction of the Para-EMT Act of 2023 aims to address significant workforce shortages and enhance training in emergency medical services, EMS, presenting substantial implications for C-suite executives in hospitals and healthcare systems. This legislation not only impacts operational dynamics of EMS, but also aligns closely with broader healthcare management and strategic planning. So as we look at legislative overview and C-suite relevance, as healthcare leaders, C-suite executives need to understand the provisions of the Para-EMT Act of 2023, which are designed to stabilize and expand the EMS workforce. Critical components for ensuring efficient hospital operations and community health services. Also looking at workforce development initiatives, the Act focuses on recruiting and training EMS personnel directly supports hospital systems, goals of reducing wait times, and improving patient care during emergencies. C-suite executives can leverage these developments to enhance their workforce planning strategies, ensuring that their institutions are well staffed and prepared for emergency situations. Looking at support for veterans, by facilitating the transition of veterans to civilian EMS roles, the Act also opens new pathways for hospitals and healthcare systems to recruit highly skilled personnel. And this can be a strategic advantage for healthcare executives looking to diversify their teams and enhance their service capabilities. So as we look at technological and educational enhancements, funding for innovative educational methods and wellness programs offers executives the opportunity to pioneer advancements in EMS training and support within their organizations. This not only aids in workforce development, but also positions the institution as a leader in healthcare innovation. Congress finds that paramedics and emergency service technicians, EMTs, are a vital component of the National Emergency Medical Services, EMS, system. highlighting the essential role these professionals play in healthcare, which is a key consideration for healthcare leadership. HR Rule 6433, 2023. So as we look at strategic impacts on hospital operations, enhanced emergency preparedness, improved training, and increased personnel through the ACTS initiatives means that hospitals can expect more reliable partnerships with EMS providers, and this enhances overall responsiveness to emergency situations, a critical factor in patient outcomes and hospital ratings. As we look at policy and compliance with new grants and training programs established by the Act, hospital executives must stay informed of new federal policies and ensure that their operations comply with updated standards. This requires proactive governance and adaptation of internal policies to align with federal changes. Also, looking at the innovation of community engagement, executives should consider how their organization can contribute to and benefit from enhanced EMS training and support programs. Engaging with community EMS services can provide coordinated care efforts and strengthen community health outcomes. The Para-EMT Act of 2023 represents a pressing opportunity for hospitals and health system executives to enhance their operational capabilities and strategic planning in response to EMS advancements. By actively participating and supporting these initiatives, healthcare leaders can significantly impact their organizations' effectiveness in emergency medical services and overall healthcare delivery. With a comprehensive understanding of the Para-EMT Act of 2023 and its implications for enhancing emergency medical services, it is now time to shift our focus towards another essential area in healthcare innovation, and that's regulations on advanced therapy and medicinal products, ATMPs. As breakthroughs in biotechnology redefine therapeutic possibilities, ATMPs, which include gene therapies, tissue-engineered products, and somatic cell therapies, are at the forefront of modern medicine. The upcoming discussion will explore the latest regulatory frameworks that govern these transformative treatments. And so we'll examine how these regulations impact product development, patient access, and overall healthcare strategy, providing essential insights for healthcare executives aiming to integrate cutting-edge therapies into their service offerings and meeting rigorous compliance standards. So for a detailed understanding of the Para-EMT Act of 2023 and to stay updated on its implementation, healthcare executives are encouraged to consult the full legislation and text-related policy updates. So looking at regulations on advanced therapy, medicinal products, ATMPs, regulatory framework and compliance, ATMPs are subject to stringent regulatory oversight within the European Union. Centrally regulated by mechanisms outlined by the European Commission and enforced by the European Medicines Agency, the EMA's involvement is critical as it includes supporting the translation of these advanced therapies into patient treatments. A strategic goal within its regulatory science to 2025 strategy, healthcare executives must navigate these regulations and ensure that their organizations comply with the necessary guidelines to offer these therapies safely and effectively. So let's look at some specific regulatory challenges. The complex nature of ATMPs include gene therapies and tissue engineered products, requires adherence to specific regulatory standards that govern their development, approval, and use. So for instance, the classification of ATMPs and their handling requirements necessitates detailed operational protocols in hospitals. C-suite executives must ensure that their facilities are equipped to meet these regulatory requirements, which may involve specialized training for handling, storage conditions, and precise documentation practices. So as we look at strategic regulatory planning, to successfully integrate ATMPs into hospital services, C-suite executives need to engage with regulatory bodies proactively. And this includes staying up to date on changes in regulatory landscapes, participating in discussions on regulatory policies that impact ATMPs, and preparing for future regulatory changes. Strategic planning should also consider potential for regulatory hurdles or delays that could impact the availability of these therapies to patients. Within the European Union, EU, ATMPs are centrally regulated and cover biological medicinal products that can be classified and either gene therapy medicinal products, GTMPs, or somatic cell therapy medicinal products, tissued engineered medicinal products, TEPs, or any combination of the three. According to Lozano Blasque, ETAL 2024. Having explored the intricate regulatory environment surrounding advanced therapy medicinal products, ATMPs, and their impact on the healthcare system, we can now shift our focus to a broader legislative landscape that could reshape the entire healthcare landscape. The debate surrounding Medicare for All. Proposals represents a significant shift in healthcare policy that could fundamentally alter how healthcare services are financed and delivered across the United States. So, as we explore this topic, we'll examine the potential implications of these proposals on hospital operations, healthcare costs, and access to services. This discussion is essential for C-suite healthcare executives who need to prepare for possible changes that could affect their strategic planning and operational adjustments in response to the new governmental mandates. So, as we look at the implications of the Medicare for All proposals, Biden-Harris administration commits to strengthening Medicare, ensuring stability for healthcare leaders. So, the Biden-Harris administration is dedicated to protecting and enhancing Medicare amidst legislative challenges. And with a steadfast commitment against proposals that risk reduces Medicare effectiveness, such as those for some congressional Republicans opposing drug price reductions through the Inflation Reduction Act. And the administration ensures continued support for over 65 million Americans dependent on Medicare. So as we talk about strategic implications for healthcare systems, the administration plans to increase Medicare Advantage payments by 3.7% in 2025, which amounts to a roughly $16 billion in enhancements. This increase is part of a broader effort to stimulate competition in healthcare markets and reduce cost, ensuring financial health and sustainability of healthcare organizations. So as we look at operational adjustments and compliance, for C-suite executives, this regulatory change necessitates strategic alignment with evolving healthcare standards, and healthcare leaders must navigate these adjustments to optimize reimbursement strategies and ensure compliance, safeguarding their institution's financial stability and operational efficiency. So as we look at Medicare Advantage, ensuring comprehensive coverage and stability, the administration's focus on bolstering Medicare Advantage reflects a commitment to providing comprehensive health care. And this commitment includes enhancing supplemental benefits like vision, dental, and over-the-counter items, requiring hospital administrators to integrate these offerings into their service models effectively. And so as we look at projections and preparedness, significant enrollment increases in Medicare Advantage and special needs plans implies a need for robust infrastructure and resource allocation to manage increased demands effectively. Hospital systems must prepare to accommodate a larger patient base while maintaining high care standards. So as we look at government action to support healthcare leadership, regulations against misleading marketing, these initiatives aim to protect consumers from deceptive marketing practices. And so as we looked at revised compensation standards for brokers, proposed changes are intended to eliminate compensation-driven biases, ensuring that plan recommendations are based on patients' needs rather than financial incentives. Another area to consider is prior authorization reforms. Efforts to streamline prior authorization processes will facilitate quicker access to necessary medical treatments and also enhancing patient care and satisfaction. Ensuring payments are accurate and cracking down on predatory marketing and preventing inappropriate care denials due to prior authorization are all part of our strategy to support Medicare Advantage, according to the U.S. Department of Health and Human Services 2024. So as we look forward, these strategies signify a significant shift towards enhancing Medicare's role in the healthcare system and promising a landscape where strategic planning and compliance are more important than ever for healthcare executives. And leaders must be vigilant and viable and adaptable to navigating these changes, ensuring their organizations are well positioned to meet the needs of their Medicare enrolled patients efficiently and effectively. And so for further information, for detailed insights into how these changes impact hospital operations and patient care strategies, healthcare leaders are encouraged to consult the latest updates from the Center for Medicare and Medicaid Services, CMS. So as we transition to public health surveillance enhancements, As the Biden-Harris administration takes significant steps to significantly strengthen Medicare and ensure that healthcare systems are well equipped to serve America's seniors, it also underscores the importance of advancing public health infrastructure. So the next topic of discussion, public health surveillance enhancements, focuses on how new governmental mandates are set to improve public health monitoring and data collection. These enhancements are designed to provide healthcare leaders with the tools that they need to better predict, respond to, and manage public health emergencies. This strategic shift is aimed not just individual patient care, but enhancing the capabilities of public health systems nationwide, ensuring that they are more resilient, responsive, and prepared for future challenges. So as we look at public health surveillance enhancements, transforming public health surveillance, strategic insights for C-suite executives in healthcare, we should look at effective decision-making in healthcare, especially within the strategic echelons of hospital management, which hinges on robust, accurate, and timely data. And the evolution of public health surveillance systems, catalyzed by recent global health crises, has significant implications for C-suite executives who oversee hospital operations and healthcare delivery. And so as we look over at this overview of a case study, this comprehensive review explores the advancements in public health surveillance that have emerged primarily in response to the COVID-19 pandemic. The analysis included a broad spectrum of literature revealing how these advancements can guide strategic decisions in healthcare settings. So let's look at the methodology. An extensive database search yielded a substantial collection of relevant studies emphasizing the shift towards integrated, innovative surveillance methods into healthcare management. And so the literature spans various surveillance mechanisms, including digital and AI-driven tools, which have reshaped traditional public health monitoring. And so some of the key findings is that the adoption of enhanced surveillance tools have profound implications for healthcare executives. And the study highlights a trend towards digital surveillance methods that offer real-time data analytics, essential for swift decision-making and hospital management. And so as we look at adapting to technological advances, the increased reliance on digital surveillance technologies necessitates a revolution and reevaluation of both technical capabilities and capacities and ethical frameworks within healthcare institutions, according to Clark et al. 2024. This shift presents a dual opportunity and challenges for healthcare leaders. Executives must navigate the integration of these technologies to enhance operational efficiency and patient care outcomes. So while addressing the associated ethical, privacy, and data security concerns, we should also look at strategic implications and policy considerations for C-suite executives. And the enhanced surveillance capabilities mean better forecasting and resource allocation during health crisis. And the review underscores the importance of developing policies that govern and use these technologies, ensuring that they align with broader organizational goals and compliance standards. Also, Discussion and executive actions. The insights from the review suggest that executives should consider several strategic actions. And that's number one, invest in advanced surveillance technologies. Implementing state-of-the-art surveillance tools can provide critical data to inform decisions about patient care, resource management, and emergency preparedness. Number two is policy development. Establish clear policies that address the use of surveillance data, focusing on maintaining patient privacy and securing sensitive information. Number three is stakeholder engagement. Engage with stakeholders includes public health officials and technology providers to ensure that the surveillance tools deployed are effective and ethically sound. Also, training and development. Invest in training healthcare staff and management on the use and implications of new surveillance tools, emphasizing ethical practices and data security. For C-suite executives in healthcare, understanding and leveraging advances in public health surveillance is essential for strategic planning and operational excellence. By embracing these technologies, healthcare leaders can enhance their responsiveness to public health emergencies and improve overall patient care delivery. The ongoing evolution of surveillance methods calls for continuous assessment and adaptation strategies to ensure they meet the changing needs of healthcare organizations and their patients. So, the connection between the enhancements in public health surveillance and governmental mandates primarily lies in the regulatory and policy frameworks that guide the implementation and operation of these systems. For C-suite executives in hospitals and healthcare organizations, understanding and aligning with governmental mandates is essential for several reasons. And number one, compliance. Governmental mandates often set the legal standards for public health data collection, use, and privacy. Healthcare organizations must comply with these mandates to avoid legal repercussions and maintain their operating license. Number two, funding and resources. Many public health surveillance initiatives are supported by funding or governmental funding and are tied to specific compliance metrics that hospitals must meet to receive incentives. For example, during the COVID-19 pandemic, the government mandated certain data reporting standards as a condition for funding. Number three, operational guidelines. Governments mandated can dictate how hospitals and healthcare systems prepare for and respond to public health emergencies. So this includes guidelines for reporting diseases, managing outbreaks, and implementing preventative measures. Number four, strategic planning. Executives must factor in these mandates when developing strategic plans, especially in areas such as risk management, emergency preparedness, and public health engagement. Ensuring that their organizations can quickly adapt to new mandates or changes in existing ones is vital for operational resilience. Number five, ethical and public trust considerations. Following governmental mandates helps maintain public trust, a decisive element in healthcare. Executives must ensure that their organizations adhere to the ethical standards laid out in these mandates, and particularly regarding the patient data privacy and ethical surveillance practices. In summary, for healthcare executives, integrating an understanding of governmental mandates into their operational and strategic decision-making frameworks is essential. And this ensures that their institutions not only comply with legal requirements, but also remain aligned with broader public goals and maintain the trust of the communities that they serve. And so, as we conclude our exploration of public health surveillance enhancements, it's clear that the integration of technological advancements and data-driven insights play a compelling role in shaping responsive healthcare systems. So moving forward, let's shift our focus to another essential aspect supported by governmental oversight, quality control, and safety standards in healthcare. And these standards are fundamental in ensuring that healthcare services provided not only meet regulatory requirements, but also uphold the highest levels of safety and effectiveness. Offering a seamless transition from monitoring health trends to implementing practices that safeguard patients' well-being. This next topic will explore how governmental mandates guide and improve the operational excellence of hospitals and healthcare organizations. Ensuring patient safety and service, health or quality remains at the forefront of healthcare delivery. Quality controls and safety standards. The introduction of common formats for patient safety data collection by the Agency for Healthcare Research and Quality, AHRQ, impacts C-suite executives and hospitals and healthcare organizations significantly, and aligning closely with governmental mandates that aim to enhance patient safety and health quality. So here's how. Number one, standardization and compliance. The common formats standardize the collection and reporting of patient safety data, and this aligns with governmental mandates under the Patient Safety and Quality Improvement Acts of 2005, which requires healthcare providers to improve data accuracy and consistency across the board. So as C-suite executives include CEOs, CMOs, and CIOs must ensure that their organizations comply with these standards, and also to enhance patient safety outcomes and maintain eligibility for federal protections and incentives. Looking at number two, data management and reporting. The standardized formats require robust data management systems, and C-suite executives need to oversee the implementation of IT systems that can handle the standardization data collecting and reporting system, ensuring that capability with the commons formats. And this is central for not only for internal quality controls, but also for meeting regulatory requirements and participating in national patient safety monitoring efforts. Number three, quality improvements. The common formats are intended to facilitate identification of systematic issues and the development of solutions to improve patient safety and care quality. Executives are responsible for integrating these insights into their strategic planning and quality improvement initiatives, and aligning hospital operations with best practices and innovations in patient care is paramount. And so as we look at number four, resource allocation, Adapting to these new formats might require changes in resource allocation, such as training staff to use new reporting tools or investing in technology upgrades. C-suite executives must balance these needs with the organization's financial health and operational priorities at the forefront. And also, number 5, looking at legal and ethical compliance. While compliance with the common formats can offer legal protections under the Patient Safety Act, executives must also navigate the complexities of maintaining confidentiality and data security. And decisions around data handling and sharing have legal and ethical implications that require careful consideration and policy development at the highest levels of leadership. And number 6, public and professional accountability. By adhering to the common formats, healthcare organizations demonstrate their commitment to transparency and accountability in patient safety. And this is essential for maintaining public trust and fulfilling accountability standards by adhering to government healthcare agencies. So in essence, the requirements to implement the AHRQ's common formats ties directly into broader governmental mandates, aiming to improve healthcare quality and safety. C-suite executives play an urgent role in ensuring these mandates are effectively translated into practice, thereby enhancing the operational excellence and strategic compliance of healthcare organizations. And so as we look at health information technology updates and advisory opinions for information blocking, to further enhance compliance and transparency, HHS proposed the introduction of an advisory opinion process specifically for information blocking as outlined in Section 3022 of the Public Health Service Act. And this initiative would provide stakeholders with the opportunity to seek clarification on specific practices, ensuring with alignment with legal and regulatory frameworks. The advisory's opinion issued would be binding on the department, preventing enforcement action against practices deemed compliant through this process. And this provision is intended to build trust among healthcare providers, developers, and other stakeholders by offering a clear, authoritative resource for understanding compliance requirements related to information blocking. Additionally, ONC would manage this advisory opinion process, including the collection and retention of fees to offset operational costs, ensuring the sustainability and effectiveness of the service. Looking at enhanced interoperability and public health capabilities, the ONC continues to prioritize the enhancement of health IT infrastructure to support more effective interoperability and public health response capabilities. And this includes the development and implementation of trusted exchange frameworks and common agreement, the TEFCA, which establishes a uniform platform for healthcare information exchange across the network. And this effort aligns with federal goals to improve the accessibility and usability of health information, thereby supporting better patient outcomes and more efficient public health responses. So as we look at focusing on health equity and innovation, In alignment with broader HHS objectives, the ONC's activities include significant efforts to address health equity through the standardization of health data. This involves enhancing the U.S. core data for interoperability, the USCDI, to include data elements that better serve and reflect the diverse needs of the population, such as social determinants of health, SDOH, and these enhancements aim to ensure that health IT systems across the country can accommodate and effectively use the pressing information to improve health outcomes for all Americans. And moreover, the ONC is dedicated to fostering innovation in health IT by supporting the development and implementation of advanced technologies like artificial intelligence, AI, and machine learning, ML. These technologies are expected to play an acute role in advancing health IT by improving the efficiency and effectiveness of healthcare delivery and public health surveillance. So as we look at the implications for C-suite executives, for C-suite leadership in hospitals and healthcare organizations, staying abreast of these developments is high priority, and the rapidly changing landscape of governmental mandates related to health IT requires continuous attention and proactive management. And the implementation of advisory opinions process enhancements in interoperability through the TEFCA and the focus on the health equity are not just compliance issues, but strategic opportunities that can drive long-term improvements in service delivery and operational efficiency. Executives must ensure that their organizations are prepared to adapt to these changes by investing in the necessary technology and training, engaging with policy developments, and participating in industry discussions to influence and respond to regulatory changes. By doing so, they can position their organizations to better meet the needs of their patients and capitalize on new opportunities for innovation and an improvement. So, through these strategic initiatives, the ONC not only aims to fulfill legislative mandates, but also to drive a forward vision for a digitally enabled healthcare system that is equitable, efficient, and aligned with the needs of the American public. The integration of advanced technologies, along with a strong focus on interoperability and health equity, positions the ONC to lead significant improvements in the U.S. healthcare system, ensuring that health information technology meets the evolving demands of its users. And for healthcare leaders must remain vigilant and responsive to these changes to harness the potential benefits and ensure that their organizations are compliant and competitive in a rapidly evolving healthcare environment. The ONC's FY 2024 budget request reflects the actions and investments necessary to take the earlier investments to the next level and drive transformation to a healthcare system optimized for a digital world. According to the Department of Health and Human Services Office of the National Coordinator for Health Information Technology, FY 2024 President's Budget Justification of estimates to the Appropriations Committee. And so, building on the emphasis of governmental mandates and to enhance healthcare quality and transparency, A national natural progression leads us to focus on long-term care facility reforms. And so as we pivot away from technological advancements in healthcare, we explore the equally essential arena of reforms in long-term care facilities. And these forms are designed to improve patient care, increase facility accountability, and ensure safer, more dignified living conditions for the elderly and disabled populations. And so, just as technological innovations aim to enhance healthcare delivery, these regulatory reforms in long-term care seek to address clinical and critical issues such as quality of life, staffing ratios, and facility oversight. Essential elements that directly impact well-being of some of our most vulnerable citizens. So let's look at long-term care facility reforms. The proposed rule for the Center for Medicare and Medicaid Services, CMS, for fiscal year 2024, which outlines updates to the facility outlines the updates to the Skilled Nursing Facilities Prospective Payment System, the NSF PPS, which signifies responsibilities on C-suite executives in hospitals and healthcare organizations. These updates will impact the financial, operational, and strategic aspects of healthcare facilities providing skilled nursing care, making it dire for executives to navigate these changes effectively. And so as we look at financial impact, the update suggests a net increase in Medicare Part A payments projected to bring an additional $1.2 billion to skilled nursing facilities. And so this increase results from a market basket update, partially offset by a recalibration of the patient-driven payment models, the PDPM. And so healthcare executives will need to adjust their financial strategies to accommodate these changes and ensuring that their organizations remain financially stable despite the shifts in payment structures. So as we look at operational adjustments, changes in the skilled nursing facilities quality reporting program, the QRP, and the skilled nursing facilities value-based purchasing program introduce new measures for reporting and performance evaluations. These changes will require operational adjustments in data collection, patient assessment, and also reporting processes. And so executives must ensure that their facilities can integrate these new requirements smoothly into their daily operations. And so as we look at strategic planning, the introduction of new quality measures related to staffing stability, patient satisfaction, and healthcare outcomes really necessitate strategic responses. And so executives should focus on enhancing workforce management and patient care strategies to improve outcomes and patient satisfaction scores, which are directly tied to reimbursement rates under the new rules. And looking at compliance and regulatory alignment, the proposed rule simplifies certain compliance processes, such as those related to civil money penalties. And C-suite executives must ensure that their organizations understand and comply with these new regulations to avoid penalties and optimize the benefits from compliance. Also, looking at health equity focus, with the proposed health equity adjustment In the skilled nursing facilities value-based purchasing program, executives must also prioritize initiatives that address health disparities. This includes tailoring health services to meet the needs of diverse patient populations, particularly those with dual eligibility status, and to improve health outcomes and qualify for additional incentives under the new rule. So let's talk about the impact on C-suite leadership and the breadth of these changes and how they emphasize the need for C-suite executives to stay informed and proactive. They must lead their organization through the complexities of financial management, operational efficiency, strategic planning, regulatory compliance, and commitment to health equity. And so effective leadership will be insistent in adapting to these changes and optimizing care delivery and ensuring that financial health of their organizations. And so in their own words, CMS explains this proposed rule would eliminate the requirement for facilities to actively waive their rights to a hearing in writing and instead treat the failure to submit a timely hearing request as a constructive waiver, according to the Center for Medicare and Medicaid Services 2024. So this change is part of a broader effort to streamline processes and reduce administrative burdens, reflecting the ongoing commitment of CMS to improve efficiency and regulatory frameworks. And so now that we've covered the main points of the fiscal year for 2024, CMS proposed rules for the skilled nursing prospective payment systems, let's open up the floor for any questions that you may have. This is a great opportunity to investigate how these changes may impact your specific circumstances or to clarify any aspects of the rules. Please feel free to ask your questions now. So, instructions for question and answers. During this question and answer session, you are welcome to submit questions to the chat feature. Feel free to type your questions as they come up. There's no need to wait. So feel free to enter in your questions into the chat box. If you prefer to ask your question verbally, please use the raise hand feature and we will enable your microphone when it's your turn. Our moderator will select questions for discussion based on the topics covered today. Aiming to address a diverse range of queries, we may group similar questions to provide comprehensive answers. So please try to keep your questions concise to allow us to cover as many as possible. So if your question isn't addressed during the session due to the time constraints, we'll encourage you to send it via email to our support team, whose contact details will be provided at the end of the webinar. A summary of the Q&A along with additional resources will be shared with attendees afterwards. Should you encounter any technical issues during the session, our technical support is ready to assist you through the chat. So let's go ahead and get started. All right, looking at question 1, how will the new Medicare drug pricing negotiation affect the cost of drugs at the consumer level? You've raised an important point, so thank you for that question. The new policy enabling Medicare to negotiate drug prices is expected to lower the cost for consumers significantly. And by reducing the expenditure for Medicare on certain expensive drugs, these savings can be passed on to beneficiaries, potentially lowering out-of-pocket expenses and premiums. So let's look at the next question. Can you explain the main changes in the Affordable Care Act updates for 2024? That's an excellent question. I'm glad that you brought that up. The updates to the Affordable Care Act for 2024 focuses on expanding coverage and reducing cost. Key changes include increasing the subsidies for lower and middle income individuals and families, and so expanding Medicare in the states that have opted into the program and introducing measures to lower premiums and out-of-pocket cost for consumers. That was a really great question. Thanks for asking. What incentives are being introduced to improve rural healthcare access? That's another excellent question. I'm glad you brought that up. The administration is enhancing rural healthcare access by increasing funding for rural hospitals and expanding the number of healthcare professionals throughout targeted training programs, and supporting the expansion of telehealth services to ensure that residents in rural areas can receive high quality care more easily. So, how will telehealth regulations change in the upcoming year? And what impact might these changes have? That's an insightful question, and thank you for asking it. Telehealth regulations have been updated to extend certain flexibilities introduced during the COVID-19 pandemic, and such as allowing a wider range of providers to offer telehealth services and continuing coverage for telehealth appointments across state lines. So this will improve accessibility and convenience for patients. So the next question is, what are the strategic implications of value-based care models being introduced? That's a thoughtful question. Thanks for raising it. Value-based care models prioritize patient outcomes over the volume of services provided, and this shift encourages healthcare providers to focus on delivering effective and efficient care. And for healthcare systems, this means reallocating resources to preventative care and chronic disease management, potentially leading to better health outcomes and reduced healthcare costs. With the expansion of mental health services, what should healthcare providers expect in terms of regulatory changes? So I appreciate the question. It's a very important one. Providers should anticipate more stringent requirements for parity and mental health and physical health coverage. So including better coverage for mental health services and underinsured plans can increase funding for mental health programs. And these changes aim to make mental health care as accessible and comprehensive as physical health care. How does the government plan to support healthcare providers in implementing these mandates? Thank you for that great question. It's very relevant. The government plans to support providers through increased funding, training programs to help with the transition to new healthcare models, and regulatory guidance to ensure smooth implementation of changes. So additionally, there will be financial incentives for meeting certain healthcare quality metrics. And so as we look at the next question, what role will health technology play in upcoming healthcare reforms? Well, what a fantastic question. Let's explore that. So, technology will be crucial in updating healthcare reforms, particularly in enhancing data sharing capabilities, improving patient management systems, and also facilitating the wide-scale adoption of telehealth. Innovations like artificial intelligence and machine learning will also play roles in diagnosing diseases and maintaining patient care more effectively. So, looking ahead to the next question, how are healthcare facilities expected to handle increased data protection regulations? That's a critical question, and I'm glad you've asked. Healthcare facilities will need to strengthen their cybersecurity measures and ensure compliance with stricter data protection regulations. And this includes investing secure technologies, training staff on data privacy, and also implementing a more robust data governance policies. And I think we have time for one more question. Can you describe the future plans for addressing the opioid crisis under the new healthcare mandates? That's an intriguing question, so let's dive into it. Future plans include enhancing funding for opiate addiction treatment programs and improving access to medication-assisted treatments, and increasing support for mental health services that address substance use disorders. So there will also be efforts to curb illegal opiate distribution and promote safe prescription practices. And so these questions and answers provide a broad overview and specific insights into the various aspects of the healthcare reforms that's being discussed in this webinar. And so as we talk about some key takeaways, navigating new norms and mastering 2024 healthcare management mandates for healthcare executive leadership provided a comprehensive exploration of significant healthcare mandates for 2024. And attendees received an in-depth insight into various topics, including Medicare drug pricing negotiations and the expansion of mental health services and telehealth regulations. And so as we talked about, strategic guidance was offered to help healthcare executives effectively integrate new policies within their organizations and to optimize both patient care and operational efficiency. A significant focus was placed on the role of technology in healthcare and emphasizing enhancements in data sharing capabilities, patient management systems, and necessary cyber security measures to protect sensitive information. And the shift towards value-based care models was discussed, highlighting how these prioritize patient outcomes and can lead to improved health outcomes and reduced healthcare costs. And so the webinar also addressed the improvements in public health surveillance and the advancements of health equity, showing the administration's commitment to ensuring accessibility and a quality healthcare across populations. And so resources and supports were also outlined for specific providers, including increased funding, training, and guidance to help with transitions to healthcare models, new healthcare models, and compliance with new regulations. And so participants benefited from an interactive Q&A session that allowed for a deeper understanding of complex issues and provided expert answers to understanding questions. Additional resources, including further reading materials and information on upcoming webinars and seminars, were offered to encourage continued learning. And so the webinar concluded with a call for feedback and enhancement to future webinars, and really highlighting events and emphasizing the importance of the ongoing engagement and community building across healthcare executives landscape. And so, hello, my name is Greg Wahlstrom, and I'm the president and CEO at the Healthcare Executive. And so I want to thank you for joining today's webinar entitled Navigating New Norms, Mastering 2024 Healthcare Management Mandates for Executive Leadership. And my commitment to advancing healthcare systems is deeply intertwined with understanding and implementing the new governmental mandates in 2024, especially in such areas as long-term care and technological advances in healthcare and innovation in healthcare management strategies. So for those of you passionate about meeting these new mandates and enhancing healthcare services, I encourage you to connect with me, and you can reach me via email at info@thehealthcareexecutive.net, and you can also reach me through my LinkedIn profile, Greg Wahlstrom, where I frequently share insights and updates on the evolving trends and regulations in healthcare management. I'm available Monday through Friday from 9 a.m. to 5 p.m. Central Standard Time, given the demanding schedules of healthcare professionals, and particularly during this period of significant regulatory changes. I am flexible and willing to accommodate meetings outside these hours as necessary. Email is my preferred method of communication for detailed discussions, ensuring that we can track our conversations and also share ideas effectively. However, I'm open to using other forms of communication channels that might be more convenient for you. So I'm always looking forward to and always willing to collaborate on projects that align with these new healthcare mandates, enhancing patient safety and improving behavioral health systems. And so whether it's a professional collaboration or a project partnership or a consulting opportunity, let's explore how we can work together to adapt and excel within these new regulatory frameworks. So please keep an eye out for upcoming events, talks, and webinars and workshops focused on mastering healthcare mandates and patient safety. These updates are excellent opportunities for learning, networking, and driving change in our field. Together, we can tackle the challenges presented by the new norms in healthcare governance and seize the opportunities to create a safer, more responsive healthcare environment. So let's connect and make significant impacts in the world of healthcare management. Additional resources and for further consideration are below. And so as we talk about moving forward, we have some additional resources below which you can use to further your readings and understanding and comprehension of some of the information that we've covered today. So as we conclude today's webinar on navigating the new norms and mastering the 2024 healthcare management mandates for executive leadership, I want to express my gratitude to all of you and your active participation and engagement and insights and questions that have enriched our discussion. Underscoring the collective commitment we share in adapting and leading through the evolving landscape of healthcare management. So moving forward, let's continue to embrace challenges and opportunities these new mandates present. And I encourage each of you to leverage the strategies and insights shared today to not only comply with, but excel under the new regulations. And so remember that the goal is to enhance our healthcare systems in ways that are sustainable, equitable, and beneficial for all stakeholders, patients, providers, and payers alike. So please stay tuned for followed up materials and resources that will be shared via email. They'll include a summary of today's session, additional reading materials, and details on upcoming webinars that will further support your journey in mastering these updates. So thank you once again for your dedication to healthcare excellence, and let's continue to lead with innovation and integrity, making a tangible difference in the lives of those we serve. Safe travels back to your respective duties, and I look forward to our paths crossing again in the future endeavors. Before you go, if you found today's session valuable, please take a moment to hit the like button or share option, sharing this webinar with your colleagues and networks. Your support helps us to reach more professionals like yourself, eager to learn more about the latest healthcare management updates. So thank you for your engagement and help and this valuable knowledge. 2024 copyright, The Healthcare Executive, all rights reserved. And just as a reminder, this webinar is being recorded.